Now we will discuss the one by one. This is the manubrium, body of the sternum, xiphoid process. So this is the manubrium, quadrangular in shape. It having the four borders: superior border, inferior border, right border, left border. Two surfaces. This is the anterior surface. This is the posterior surface or inner surface. So how to identify this inner surface or outer surface? So outer surface, somewhat it is a convexity, and when you are feeling here, rough impression is there. Whereas here manubrium, smooth surface due to the covering of this mediastinum, superior mediastinum. Next, what are the attachments to this manubrium? See here, superior border not a straight line, it having here notch is there. It is called the sternal notch or jugular notch. This is called a jugular notch. On either side of this jugular notch there is a facets for the clavicular notch. Here the clavicle is articulates to form a sternoclavicular joint. It is a saddle variety of synovial joint on either side. Next, below this we can identify another notch is there for the articulation with the rib. First rib is articulates. So here costal notch is there. First rib is articulates. Below this, here we can identify the second rib is articulates, where the lower border or inferior border of the manubrium or the body of the sternum to form a joint, that is called the manubrosternal joint. That is the sternal angle. This is a sternal angle. We will discuss later in detail about the sternal angle. Next attachments anteriorly. Here these corners are lateral surface. Here we can identify the attachment or origin of the pectoralis major muscle. Pectoralis sternal, that is the manubral head of the or the sternal head of the pectoralis major muscle origin. Whereas here notch either side, here we can identify the sternal head of the sternocleidomastoid muscle. Always sternal head is tendinous, that takes origin from here. Whereas here we can identify the pectoralis major muscle. These are the attachments anteriorly. Thank you.